but we want them to track every part of their body because you'll see other results besides some of the things that you presented with.
I like this question, by the way. This is from YouTube. Hi, Doc. What do stem cells actually do to the brain when it comes to pain? Are they repairing nerve damage, calming inflammation, or doing something else entirely?
Yes, actually. So pretty smart of you to say the two most significant things that stem cells do. They have the ability to shut down the inflammatory cascade. That's why we see that it works well for lupus and rheumatoid and inflammation in joints. One of the things that we see, people will come in with a swollen knee because they've been walking around on torn tissue, and your body typically allows that swelling to maybe remind you not to do much activity, to get your attention to the joint. Sometimes as tissue is damaged, the swelling occurs. And once we do the stem, the swelling starts to go away. So that's one part of it. The other part is that they're going right to the areas of damage and degeneration and becoming those cells. So if you're talking about brain cells, heart, liver, kidney, pancreas cells, ligament, tendon, cartilage, they become those cells. That's their only job. So you're putting brand new cells where the damage is. So now you're making your neurotransmitters again, if we're talking about the brain. Or with your pancreas, those new cells in your pancreas that are brand new pancreatic cells that used to be stem cells moments before are making insulin. So you're getting brand new cells in your organ to decrease the blood sugar. So that's typically what they do.
Should we play a clip from this?
Yeah, let's play a clip.
I think they need to see it.
Tom's a terrific interview, yeah. And you had come down to the office, I guess it was about 5.5 years ago?
Yes. I think it's also important for people to understand that not only what the disease was happening to me, this wasn't an ailment of arthritis or back pain where something with therapy or pills or medication can be helped. We're talking about life-saving. When Mike reached out to me, I was at the end of my rope. I had lost hope, and I had tried everywhere. And if it wasn't for Mike and Dr. Calapai, you wouldn't be seeing me on this video right now. Without a shadow of a doubt, my wife would be a widow. And I think it's important that people need to understand that it wasn't that bad and that severe. And there are people out there that are still suffering. So I'm making this video to offer hope for people.
It's so important. And we've seen other people that have spoken to you and thankfully had another gentleman, which we're going to interview, I guess, within a couple of weeks, that had a similar terrific result. So the idea is really getting the word out about the disorder, how bad it is, and how urgently, medical professionals and administration really need to understand that this is really the only important way to be able to change the mechanism, and that quickly. So the more, and I talk about educating people all the time. You ask 100 people about cluster headache, they'll be like, oh, yeah, I know it's a bad headache, and it comes in clusters. They just don't understand it. So this is so important for you to be able to tell people what your experience has been. Yeah, pretty dramatic. Emotional, too. You can't sit there and talk to someone, and certainly when he started seeing the results over the first couple of days and he called, it's an emotional call. And then a week later and a week after that, and, it just progressively changed and significantly changed his life, which, of course, we were thrilled, to be able to be a part of and to see that happen. So I want to reach out to a lot of the cluster headache support groups. I've been asked to give lectures and such, so we're going to be doing that over the course of the next couple of months. I might even toy with the idea of doing a lecture at the Marriott Hotel. I did that for many, many years. When I first got into practice and when I first got on the radio, I would talk about, giving a free lecture at the Marriott Hotel and tell people to call the office and reserve a spot. And we get 200, 300 people to come to the Marriott, which is a little bit overwhelming, but it was great because, people would ask questions and I'd sit there for 3 hours and people would ask and I would answer. And we covered every topic you could possibly imagine. But by the end of that evening, because I worked all day, I was shot. I was, ready to go to sleep right away because I was just all talked out. But it was great. I love doing it. So we may do that I'll kind of put the word out and see how many people would like to come to a lecture. And we could try doing that again. You just have to call the office and say you want to sign up for the lecture. The office number is 516-794-0404. It's fun. I like doing it.
So this is just a great question over here. Said that guy had metal rods implanted in his brain and it still didn't help. Why are doctors jumping to surgery instead of trying stem cells first in cases like this?
So the ultimate answer to the questions of why doctors are doing other things in many cases is because A, they don't know any better. B, the other thing they're recommending is a big ticket and is an expensive guess or trial at something that may or may not work, but the doctor may be, billing the insurance company for a ton of money for things like that. I get that question asked all the time. I had a lovely lady with rheumatoid today, and she said, I saw your videos, I saw this, that, etc. Another gentleman came in today with Parkinson's. He said, I don't understand, why this isn't something that's all over the place. I said, look, there's a very big mechanism out there that wants to keep you on medications and get you on 10 or more medications for the rest of your life. Everybody knows that. And there's sort of a system that just runs that way. If I could do a stem cell injection into a joint and a person doesn't need surgery, especially with general anesthesia and all of that, why not? But you don't see people that do the surgery saying, oh, no, don't do the surgery. Do the far lesser invasive and lesser costly procedure. So everyone knows that, the realm that we're talking about is a business, and the traditional realm does what it does. There are some great orthopedic doctors that I've met, and some of them across the country, that have done PRP and stem cells, and they put it as part of their program. It's great. But most of them don't want to change. The neurologists don't want to necessarily refer, except one of the first people we interviewed here, Phil, was a gentleman with great results with stem cell. And when he went back to his neurologist for his routine appointment 3 months later, the neurologist looked at him and just stared and said, what the F is going on? Well, I don't understand. What happened? Because he had to give him Botox injections every 3 months to get the spasm away. And he described what he did, and his results dramatic. And the doctor called me that afternoon. He goes, I don't understand. I said, well, I'll show you some research, some articles, et cetera. Look at the videos. And he went crazy over it. And he still refers patients to us. So it's as if people in their job are comfortable with status quo to some extent. And these are people who are really intelligent people who go through a lot of training in medical school, et cetera, internship, residency. But they're comfortable with that status quo. And there are those who are not. But I can tell you virtually every patient that I've seen and every patient coming to me has the same ideas that I do. Let me look, let me learn, let me try, let me fix, They're much more interested in researching it than some of the traditional realm. So yeah, they have the problem. They want to find something to create a better result. And they don't want to rely on the medications necessarily. I'm not saying you can't use them, and they're certainly great for certain things and many things, but if you have high blood pressure and you're overweight, why wouldn't you want to come in, get tested, correct your vitamins, minerals, hormones, cut the carbs, do the exercise, burn down the weight, and get off your meds? We do that all the time. Same thing with, cholesterol, same thing with so many of the things that we see. So, and there are patients that I'll put on blood pressure pills because they come in their levels through the roof. And they haven't seen their doctor, or they switch doctors, or they can't get to see their doctor. I'll put them on meds until we can get the mechanism understood and fixed and changed, and we get them off the meds. So it's just a whole different world of thought and approach.
We got a question from Jedi Legend on Rumble. Love
Jedi, cool.
says, is there anything that can heal the pancreas or make it work again?
Yes. So we were talking about this in a small way a little while ago, but we have a lot of patients that are diabetic. And those individuals, as we review and go over their information, we have them cut the carbs, which decreases sugar coming in, which makes it easier on your pancreas that's not doing as well. Do some exercise, burn sugar, burn fat, correct hormone decline, correct vitamins. You have some significant result there, and your sugar can start to come down. But doing stem cell therapy, we're taking your cells from your body, spinning them to separate them from red blood cells, plasma, take them from the bottom of the centrifuge vial, set up an IV that takes 10 minutes. That goes into your vein, and sort of like being on a train going throughout your entire body, those cells will get off the train, set up shop in your pancreas, and become new pancreas cells that make insulin. That's been documented. That's been proven. And we use it for all the degenerative disorders. If you look at the videos on the website, drcalapai.com, you'll see 2 patients that have had diabetes in 2 to 4 months are non-diabetic and not on meds because of a stem cell IV. Yes, we get them to eat better, get them to exercise, get rid of junk food, work up and improve as many things as you can, but the ultimate mechanism would be stem cells repairing your organ. That's the biggest change to your body.
We have another one from YouTube that says, the story that you gave honestly gave me chills. How does it feel to see someone go from literal brain implants to completely pain-free just from stem cells? And how often do you have cases like this?
It's an amazing story, amazing case. Initially, 6 years ago, did I know he was going to have a wonderful outcome? I thought he would have a good outcome because everybody else did. For other disorders, as I say, liver, kidney, heart failure, stroke, MS, Parkinson's, a lot of these things, pulmonary fibrosis, macular degeneration. But to see this turn into a picture, a fact of having 6 years worth of no headaches and no problems whatsoever from one treatment is pretty spectacular. It's the greatest thing I think that I could do or I've done. We've had other patients and MS and Parkinson's patients out of a wheelchair in a month. These are spectacular things. And, I pray for my patients all the time, and I want them to be able to be as healthy as humanly possible. And to be able to do this with one therapy is staggering. It's sometimes, initially, it just sort of surprised me that things can happen so quickly, but your body has its patterns. It has its blueprint. It has his way of working, and we're just allowing the body to do what it wants to do by using its own material, its own cells, to achieve that result. I think it's the greatest invention, discovery, idea that's ever existed in medicine and in science because your body repairs itself. It's the greatest idea, and I'm thrilled to be able to be a part of this. And as we're working towards getting the word out to more people and working with different people that have friends in high places, hopefully we'll be able to do more and more of this to more of the people who are super deserving of this. So I won't speak as much about that now, but I'm going to meet someone tonight and have a couple of phone calls over the course of the next week and, keep pushing to get it observed, recognized.
Yeah. The next question is, how is this not the gold standard? We have another question saying, obviously you just answered that one, but what about a voice cord? I had parathyroidectomy.
Parathyroid, yeah.
During surgery, my left voice cord was paralyzed. I'm late to the live chat, but hoping this will work? ? Hello, Trump Girl 17. Great to have you.
It's entirely possible, if we look at the entire picture in the case, that we may be able to use these cells intravenously and maybe some through a nebulizer where you're breathing it in through your mouth to see if we can get some of those cells to create a benefit or response there. I have yet to treat someone with vocal cord damage per se, from a surgically induced procedure, but the cords have blood flow. So if you do an IV, the stem cells in the IV will go to wherever your blood flow goes. So, before we treated the first cluster headache patient, I wasn't 100% sure. Before I treated the first Parkinson's, MS, Alzheimer's, dementia, all of these things many years ago, I wasn't sure. But, doing so much of this over time and seeing great results, I think it's got the greatest potential of all. So, yeah, it's entirely possible.
I'm putting, obviously, this is the office phone number if you want to reach out and get something going for this.
Yeah.
And then also the website, drcalapai.com. It's on throughout the whole show.
516-794-0404 is the office number, and the website, drcalapai.com. We'd love to hear from you. So every person that I see, those that do STEM and those that don't, have the same question. Why isn't this the gold standard? Because there's a very big mechanism and a very big freight train rolling down the tracks that's not going to change because they're doing the status quo, which is good for them. People don't have to think too far to understand that they're a vested interest in doing what they're doing.
Line in their pockets as well.
Yeah.
She said, thank you so much. I will definitely be checking into this. You're very welcome. And we love your username, personally.
Absolutely. It's so funny. I have so many patients that are commenting and are blown away at the president's ability to go to these other countries and with no effort at all create a business deal. And honestly, back in the day when he wrote The Art of the Deal, I'm like, oh, that's pretty cool. I'm like, yeah, this guy's probably got some good skills. And he built his business and, the TV show, a little grandstanding, but it was, it was funny. It was entertaining. And I thought, yeah, this guy's got some serious skills. And he grew up and his dad was probably a brilliant guy and did what he did, and et cetera. But seeing what he did the first time he was elected was really impressive. Within no time, everything changed, for the better. He didn't know the game, but he improved things, and unemployment was super low for all of our, friends and people in different communities. I'm like, wow. I didn't think that was possible because of years before. You never saw that before. I said, so yeah, maybe there is something about being a businessman running a business, and of course, a very astute businessman running a business, and making these changes. And now, 100 days, little plus over that, into the second time where he really knows who and what he's dealing with, to see this is just, it's staggering to me. To be able to take people who did not necessarily respect other administrations, roll out the biggest of the red carpet, roll out the king going to meet him at the play. I mean, I never expected that, nor would I expect him to make deals within a day. For this to come back, it's a $600 billion deal and a $1 trillion deal. It's staggering to me. I have a little business skill. I have a little negotiating skill. He's got spectacular negotiating skill. And what he's doing for all the different people of the country, like he did before, with prices dropping down and cutting down the expense of medications for all people, the prices of eggs dropping. I mean, there are people that don't like him because of what he says or how he looks and blah, 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 but you got to give him credit. He's not doing things for himself, that's for sure. He's lost money, getting into the job. But he's doing things that just are unbelievable to me. And I give him 1,000,000% credit for doing these things and doing them right away. It's just, and pulling the people in that he's pulled in to be able to do what he's doing. So as much as the other side of the street wants to yell and complain and this and that, they never did any of this and couldn't. but he's done it and he's doing it. God bless him.
God bless.
Don't want to get too political, but look, fact is fact and truth is truth.
And you do mention, this whole thing where the pharma, the drugs and all this, and basically saying, the least, the cheapest nation that you're selling this to, we're taking that price. That's basically what he said. So
Yeah.
and it's just crazy to me because I'm just, not getting too political.
We can be political. We can talk about what we want to, right?
Yeah.
This is a great station. The point that we're making is, if a massive company is selling the same drug for much less to another country, and we're paying 5 times more than that,
and some cases they're making it here.
yeah, I don't understand. They're just fleecing us on purpose. I've always had the aggravation of that because I've always had patients that say, "Wow, I can't afford that drug." And my cousin brings the drug over from another country, or I can get it in Mexico or a Canadian pharmacy. I'm like, why are we getting fleeced? But now you know why we're getting fleeced. Look at the USAID thing.
Right.
We're getting fleeced. So at least this is going to change. This is going to stop. Nobody can argue that that's a bad thing. No one can say that stopping pilfering and taking too much taxes from us and using it for these insane things and really lining their pockets. Wait till you see which guys are lining their pockets.
Right. And what I was also going to mention is just there was the last administration, we'd always like to just make sure he was getting through the speech, get a little nervous at times. But there was one speech specifically where I remember him being on stage and being like, "We beat Big Pharma and it mattered."
Yeah.
And it's like, now you see,
It's
it's
all
like,
lies.
what did we beat?
No.
We had a lot. What do you mean?
They
Beat
use
what?
their comments to make people that follow them blindly think that something's being done. The only thing that was being done is that politicians were getting kickbacks. You'll see it. They're getting kickbacks from the Ukraine money. That's what's happening. Okay, friends.
People are loving this, by the way.
If you'd like to call in to ask your question.
Oh, yeah. We didn't even tell them that we have a phone number you can call right now. We're live. It's Saturday. It's 3:10 Eastern. All right. And we do have a question just saying, are there legal limitations in the U.S. that prevent more doctors from using stem cells for things like this, even though they clearly work?
There's no legal limitation. When people think about stem cells, when they come in and we talk about it, they say, "I heard that Bush made them illegal." Well, that's only partially true, but he only maintained a ban on aborted fetus because nobody wanted to make a big business out of aborted fetal tissue except those companies that are taking that tissue and using it for the V word and other
You could say
experimental things. Yeah, vaccines. So that ban was maintained, appropriately so. The doctors like myself throughout this country and other countries can go to get trained, you try to get into a clinical trial and do something in a scientific way. And then, it's not inexpensive, but it's a lot of cost to getting trained, et cetera, to getting your fellowship certification and doing it. But doctors traditionally just don't want to go out and do something different. They don't want to be the maverick. They don't want to do things that are beyond what their scope is. And in part, this is a interesting comment to make. When you get out into practice and the hospitals want you to work there because they want your patients. So if you're a family practice doctor, hospitals want you to bring all your patients there for whatever you can bring them there for. Blood work, cardiac testing, surgery, all the different procedures. And in that realm, you'll be signed on to taking call where if a patient on the night that you're on call has an issue, you have to address that. So if a person's having a heart attack and you're the person on call in the emergency room for that evening and you're there or you have to be available, then you'd refer that patient to the cardiologist, refer them to all the specialists for those things. If other doctors are there on call doing the same thing, it's this whole mechanism of having a bunch of different doctors evaluate you, appropriately so, and do the best for you. But if you're the doctor that's doing something that they don't either know about or like or agree with, it ain't going to work. So there's a network. which has benefits for those doctors to work closely together. And I've had patients that I've sent to doctors, and they're just spectacular all over it, fix things perfect. There's a great mechanism for that. But if you're not part of that mechanism, if you're trying to do things that are getting people healthier or off meds, or you're using something like STEM, they're not going to let you in or on board. So
someone just asking a question about, they've heard that once you lose a brain cell, they don't come back, and they're asking, do stem cells actually build back brain cells?
Of course. So 160 some odd years ago, Dr. Haeckel was the first to call it a stem cell, and research has ensued. If you look up stem cell therapy on Scholar Google, you'll get 4 million citations, studies, so you can read the studies. If you look at the videos on my website, MS, Parkinson's patients getting out of a wheelchair within 1 month, patients with stroke being able to talk and function and walk, normally again, it's because the stem cells, when they get to the brain, become brain cells. So let's say you have 1 trillion cells in your brain. And over time, this is as a kid, you've gotten older and you've lost a lot of them. And some of them are damaged by heavy metals or too much alcohol or injury. Those cells died and they're gone. But when you do stem cell therapy, they know to go to the areas of damage or degeneration, become brand new brain cells that make the neurotransmitters again. That's the only reason why those patients with those disorders that I mentioned could have that kind of benefit. No drug could ever do that. No vitamin could ever do that. But your own cells will go there and become the new brain cells again. So now you have a growing population of brand new brain cells, or heart or lung or pancreas, etc., to create those changes. Best way to describe it, I think.
Yeah. And have this question from Rumblemania1. Hello, Rumblemania, asking, came here late. Does this treatment help non-Hodgkin's lymphoma?
So there are doctors who are in hospitals that will use stem cell therapy for cancer. I don't. I'm not an oncologist. But there are doctors who use bone marrow transplants for cancer patients, and that's part of their realm. So it's usually a protocol where a patient stays in the hospital for a few weeks, could be 3 or 4 weeks. They radiate and chemo you half to death, and then they put your stem back in to create repair and build your body back. So it has been used for cancer.
I like this question. What is we have one? We've answered this one, but they're coming in late, asking what's stopping this from becoming FDA approved.
The FDA has no real jurisdiction over it because it's not a drug or a device, because it's your cells. And in their documents, they say that they allow or approve using your own cells without manipulating them.
And then we have this question. Your stories make it clear we need to rethink how we define standard care. Do you see a future where stem cells replace pain meds and surgery altogether?
Not altogether. I see a future where people have more access to it, and where more and more documentation has been ongoing, continues to show the safety and the nature of the result. I mean, whenever you look at a stem cell study online, in the abstract, it's the initial idea, the opinion, the method of technique and, results, and then conclusion, you always see safe and effective, safe and effective. So it's not something that's going to go away. And I think more and more research is done on it almost logarithmically year to year because, 50 years ago there was some, and then 40, 30, 20, the amount of studies is skyrocketing, especially over the past 5 to 10 years. So I think it'll always be there. It will continue to be something researched. And there's 4 million plus studies on stem cells, even on one search engine. So I think it's here to stay, and it's just people have to kind of learn more about it and understand how good it is for them.
We have another one from our boy Jedi Legend. He said, what about those whose kidneys have lost full function? Can kidneys be restored at all?
Well, it's been used for chronic renal failure. So back in the day when I first found out about it, and I went to take, a course, a week-long course, I think, and understood the technique. It's not a difficult technique. Initially, the clinical trial was about using fat. So, we would suck fat from the love handles or a little bit of abdominal fat. And of course, everybody wanted to have all their fat sucked out, which you can't safely do. But the procedure is not difficult when you're doing fat. You're just numbing the area and, using some lidocaine and a saline and putting it into the area and then sucking the fat out. A little bit of work, but when it was switched over to bone marrow, it's simple. It takes a minute and a half to sterilize, numb, and extract from the crest of the ileum. And it's a relatively easy procedure. And the results are pretty significant. So it's not a hard thing for people to understand or for people to do. So when we first did that, and appropriately so, the people that ran the clinical trial spent a great deal of money putting that together. So they charged for the course, which was not inexpensive. And the paperwork for each clinical trial was 100 and some odd pages, and we had to purchase the right for the clinical trial. So I had to buy diabetes, liver, kidney, heart failure, lupus, rheumatoid, MS, Parkinson's, stroke, all of those things, which I did willingly because I knew how well it was going to work. So those protocols included almost all the degenerative disorders, including chronic renal failure. We've had patients that are told that they're close to needing dialysis that have not gone for dialysis.
We got Rose in the chat, Rose 1776, asking, what about autism or epilepsy or the two together?
I think seizure disorder would work well with STEM because the reason why the seizure is occurring is because of aberrant, abnormal electrical signals in the brain. And sometimes that comes from tissue damage if you're a young individual because of infection, maybe as a child, but heavy metal exposure certainly can correlate with seizure. There are many things that may be behind it, but putting brand new cells into the brain makes all the sense in the world. We've treated some young autistic individuals in their mid-teens that have had very good results. So I'm not saying that this is going to make the person as if they're completely perfect and never had any issues again, but any inkling of improvement, any significant improvement as well, is important, especially for people that have a great deal of difficulty with their cognitive function.
Okay, I'm in Canada, and I don't think stem cell therapy is available here for this kind of pain.
No.
Are patients crossing borders for this, and is it safe to do that?
Absolutely. Absolutely.
Hop that border.
Tom, the gentleman that we just spoke about before, came from Canada, and he was friends with, do you know Bubbles from the Trailer Park Boys?
Of course.
He's a great guy, character and a half.
I could imagine.
You can't be in the room with those guys and not be crying to tears, especially Mike. He's got one of the best personalities I've ever met. But we got a lot of Canadian people coming down.
So it's not allowed at all, stem cell in Canada?
Well, so Canada is a socialized medicine type disaster.
I did know that.
And I can tell you, all of my friends that are up there, you can't get testing done because there's no MRI facilities like we have here. So I think in this country, and certainly in the big cities, you'll get a group of radiologists together and say, hey, we want to put money together, get us set up for a great radiology center. Once that works well and does well, we'll open another and another. And all of a sudden you see 10 or 15 radiology centers created by this group of doctors, and they add doctors in. And now you can get MRIs easily anywhere, which is wonderful for us and wonderful for American people, patients, doctors, etc. And years ago, of course, MRIs were reimbursed at much higher rates. And now they're reimbursed at lesser rates, which is, relatively fair, but you can get them. I don't see that up there because doctors are not in a private practice mechanism up there. that these guys can do that, and that's why it's not done. You may have MRIs at hospitals, but other than that, you can't get them done. People have been coming to the States. Buffalo's right across the divide. And a lot of people will go there for MRIs or CAT scans or cardiologists or even cardiac procedures. And they're paying for them out of pocket. To mention, there's a great stand-up MRI facility that we use in Carl Place, and they own like 15 places all over Queens, Brooklyn, Long Island. And for people that have no insurance, their fees are dramatically reduced, like $300 for an MRI if you have no insurance. Or normally they bill close to $1,000. So at any rate, there's no, not inducement, there's no ability for doctor groups up there to do that sort of thing. But down here, it's everywhere. Look at MD, City MD. I know one of the doctors is a principal in that. Wonderful guy, Lenny. And they've got these wonderful facilities, and they pop up all over the place. They can do that because here, it's supported. And, small business and business here can do that. You just can't do that there.
Have this one regarding stem cell treatment. How about hypothyroidism? Does the treatment work for this? I've been told that med is needed for life.
So for the people that are told med is needed for life, those are doctors that have one perspective, and it's to create medication, use medication. We have people where we fine-tuned their diet. We've given them some iodine because that can help with the thyroid. Some will stay on the medication. Some will use less. We've had people that have had benefit because we've done stem for them. I can't, out of all the stems that I've done, look back and see how many of them had low thyroid. I mean, I'd have to get on the computer to figure that out and see how many people may have gotten off their meds or reduced their medication. So I'd have to look at that and see if I can pull it out of the computer. But it stands to reason because when you put stem cells IV, it'll go wherever blood flow goes. So we know you're making new cells in all of your organs. We've seen ejection fraction numbers that are low in the 20s go to their 50s. That's a contraction of your heart by doing the stem cell IV. We've seen so much of that. And just as you might see that on the website, drcalapai.com, you can see the results of these things. So I'd imagine that you'd get some significant benefit, but I can't give you an overview because I've never looked at stem cell therapy for the diabetic that also had a hypothyroid condition. But I would anticipate that there'd be benefit.
And then we have one that's just asking, how soon does after the treatment do the patients usually start to feel relief?
That's a great question. The best way to answer that is we have to figure out how much damage a person has. So let's say you have a little tear in your knee and we inject your knee. You probably will start to feel better within the course of a week or two, and maybe by the second or third month, you might feel great. If it's multiple tears or damage, it's going to take longer by virtue of the fact that you have to grow more tissue. I tell people you can't shave your head one day and expect to have a full head of hair the next day. Sound like Dr. Phil, He's got these cool Southern Texan accent, comments that he makes. I'm like, wow, that's pretty interesting. So the people that have liver, kidney, heart failure, it takes time. But you can see increments of improvement by looking at the blood test to see what the liver markers or kidney markers or the cardiac markers are, or repeat an echocardiogram. So the more tissue damage, typically it takes longer to create that repair. However, the patient with Parkinson's that I spoke about was out of a wheelchair in a month, which is faster than you've ever seen for anything. The same day we did his procedure, and you can watch it on the video on the website, had brilliant color vision the first day we did it. So he had significant color vision the same day we did the procedure, which doesn't really happen much, but when you see quick results, it just shows how well your body can repair itself. We injected my friend's son. He's a big kid, 6'4" now, probably 6'5". This is when he was younger. Big, burly kid and strong kid. Played hockey. You don't want to play hockey or any contact sports against him because he's so big. But he was playing hockey and someone tried to chop him and, he knocked that person down, and his skate hit the back of the boards behind the goal net. And that force of skating hard back there and sliding out, he broke his ankle. And you can't break a bone without having damage to ligaments and tendons that stabilize that bone. So if this is your ankle and the ligaments are going across to the side of the bottom of your foot, he saw the ortho, and the ortho put him in a cast. And then we got him out of the cast, and the bone was doing better. We just injected stem. We did IV and injected all around the ankle. And within a week, he said that the pain and swelling was gone. So you can see results quickly depending upon age or depending upon how much wear and tear and damage is there.
Well, you're gonna like this. This might be the we'll call it him or her the viewer of the day, because Dr. Chris is gonna like your username. But Elvis Freak,
oh my God,
is asking, does it help with neuropathy?
Yes, it does. Thank you very much. It does help with diabetic neuropathy. We've seen that. We've done intravenous on diabetics, and then we take some of the stem and inject down the leg where the neuropathy is, so the cells can go to the areas of damage and degeneration, create repair. So yes. And which video did we have me wearing the ring? Was that one of the first ones?
It was. It was.
So for Elvis Freak, I'll tell a quick story. Many years ago, I went out to Vegas because, you know, you go out there to take courses and you get CME credits, medical education credits. Walking around, I stayed at some little hotel, the Alexis Park Hotel, which was still there, strangely enough. But that's where the conference was. Fine, cheap. Was walking around, I see this Elvis Arama Museum. I'm like, oh, how cool is this? So I went in, walked around, see some of his cars, his army uniform, karate uniform, some of his jewelry. I'm like, oh, this is so cool. And I had been to Graceland a year after he died, but everything wasn't all open and set up. At any rate, I'm a gigantic Elvis fan. So I'm looking around, and I bought some of these standout, like the ones you see in the movies, the cardboard cutouts of Elvis in the position of the Jailhouse Rock poster and, cool stuff. I turn the corner, I see the karate uniform. I'm like, oh, my God. I'm like, how cool would this be to have Elvis's karate uniform? And I was just started out in practice at that point. It was like the early 90s, and I couldn't afford anything. I was eating the buffets like every day. I went to a different hotel to eat at the buffets. So 2015 or so, 16, I forget. And besides seeing the karate uniform, I saw some of his jewelry. I saw a ring and cufflinks. So 2015 or 16, I'm on the computer looking at things. I'm like, oh, Graceland, let me go check it out. So I go to the website, Graceland auction. I'm like, auction? So I sign up, etc. They sent me a book that was like an inch and a half, 2 inches thick. It was all the items they're auctioning off at Graceland. I was like, wow, this is crazy. So I look through there, I'm flipping through the pages. I'm like, it's the same karate uniform that I saw when I was out there in the early 90s. I said, this is like meant to be. Now I can afford it. So I called the woman at Graceland who ran the auction. And I said, I can't come down there midweek to auction. I'm a doctor and blah, blah, blah. I have to work. She said, well, put the highest amount that you would pay for that item in on the internet, et cetera. And if that's the highest, and as it goes up to whatever it ends at, if you're the highest bidder, then you get it for whatever the bid stops at. I'm like, great. So I did that, and I put in a high bid, and I'm saying to myself, oh, my God. And you could watch the auction online, but it wasn't really kind of real time. It was a little bit sold to the internet bidder. I'm like, say the person's name. I mean, who won? Of course, they didn't tell me. It was a Friday. I had to wait 3 days until Monday. They called me and told me I won. So I had it shipped up to me. It was spectacular to have the karate gi. And I have pictures of him wearing it. So that was in July. In October of that year, I got another catalog. I'm flipping through that catalog, and I see a lion head ring with lion head cufflinks with a diamond and rubies in it that I saw when I was in Las Vegas in the 90s. So now I'm freaking out. I'm like, I've got to have that. I said, I don't care what it costs. And it didn't cost a crazy amount. I did the same thing, put the bid in and won it. So I have his unique one and only lion head ring with a provenance, cufflinks that match, which I refuse to wear because I don't want them to fall out somewhere and I lose my prized possession. And so I've got his cufflink, his ring, and his gi. So
Unreal.
for Elvis Freak.
Elvis Freak is loving it.
There you go. Thank you very much.
And yeah, he's this guy's got some pipes. No one knows, but he's got some pipes.
I sing Elvis and Sinatra every day in the shower, so
And I will say, Elvis had some small fingers. Because that thing's a pinky ring.
Yeah, I can only wear it on my pinky. He didn't have big hands. I have big hands, which is fine. I might even wear it tonight. We have an event to go to tonight. It's the Italian American
Civil Rights League.
Civil Rights League, which I have a friend, Gerard, who is part of it. And our other great friend from New Jersey, Mr. Crispy, will be there.
Oh, the chat's going to know that name.
So, yeah, we're going to have a wonderful time tonight. And I just might wear my ring.
Wait, so Elvis Freak says, I owned a cardboard cutout until it wouldn't stand up any longer. Cool story. I would take them off your hands anytime.
No, they're my prized possessions. I have them downstairs in my gym, in my den. I think I have the Jailhouse Rock, and I have the one in the gold lame suit. And I actually should buy some more of them.
I'd walk down there and be like, oh, my goodness.
Yeah.
Scare the heck out of me.
When I first got them, I put them up. You know, you put them together. They're life size. And I had them in the living room of my house because I just put them together in my living room. And I forgot they were there for a moment. And then I came home one night. I probably had a couple of drinks, went out to dinner with friends. And there were no lights on in the living room. Just had lights on the outside. I walked by the living room. I freaked out that there were like two, marauders or people that have brought it into my house, of course. When I turned the light on, I felt like an idiot. But
Well, we have another question in the wings from our boy Jedi. He's just saying, here's one, but personal. Can stem cell help men with ED?
yes, so there's a protocol that's been used where you do the intravenous part, and then you take some of the stem using the tiniest of tiny little needles after we numb the base of the area, and on both sides you inject it to put those cells directly into that tissue to create repair. Now, granted, those individuals, we have to have the conversation of their testosterone levels, IGF-1, and everything else. If they have circulatory issues, if they're diabetic, et cetera, maybe neurologic components. But yes, we do that as part of the protocol.
All right, checking. Elvis Freak said, LOL, same, my kids would be startled. But no questions are taken care of thus far. It's good. This is fun today. People are.
It's a good, lighthearted conversation. Yeah.
Yeah, exactly. Let me check YouTube. I didn't forget you, YouTube. Up to date.
Yeah, if people know others that might benefit from the stem, we've always told them to take a look at the website. Certainly email us to the website. We get more emails to the website than I can handle, honestly. So I have a couple of my staff working to answer some of the emails, and some of them are long, like a page long. And, the staff can't answer a page long email. So I'll read it and look at it and say, yes, we may be able to do this, this, and this. And the patient will, talk to the staff and get that all set up. So for those out there that have questions, you could email us any time of the day or night. And of course, during working hours, we'll answer those questions. We do that for everybody. And also for those people out there who want to talk to me, we can set up the telehealth consult. We can do that from anywhere. I'll be in the office. You can call them from anywhere. We do it from all over the country. When people can ask their question, we can send prescriptions to get their blood work done at their local lab and then review them and give them, the overview, an idea. And we do that for the vitamin consult too, where people can set that up, the telehealth, and we can get them on the vitamin pack, specific, custom to them based on their blood test. So there's a lot we can do.
We got the website up there, and we'll have the office phone number. Copy that down. Also, to the Rumble audience, remember we have this show on Monday and Friday as well on the personal channels, YouTube, Rumble, Instagram, TikTok, the Optimal Health Program.
Yeah, we have to look tomorrow or the day after to see what our Rumble numbers are. we've had some spectacular numbers on Rumble, thanks to our LFA audience. I think our highest number was 115,000
Yep.
views. And we've consistently hit 70s and such, so we love to be able to do this. And with any luck, we want to work on doing a midweek program. So
Working on that.
We'll
we
see.
do have a couple more questions before we go.
sure.
Doctor, you gave me a smile throughout this whole show. I know plenty of people for you.
Thank you.
That's awesome. Love that.
Thank you.
And also we have, what do you think of med bed?
Bed? You'll have to describe that to me.
We'll look into it for next episode. We got you.
Med bed. There's so many abbreviations that sometimes are hard to understand. Med bed. These are just showing hospital beds, which I don't think that's it. Oh, Life Force med beds. It's a soft hyperbaric chamber. So I got certified in hyperbaric in the late 90s. And if this is what you're talking about, real hyperbaric is a hard chamber, not a soft chamber. You need a hard chamber, either plexiglass. I'm not a fan bag because you're not getting pressurized oxygen. You're just getting room pressure oxygen. It's got to be at least 1.5, 2.5 atmospheres of pressure to get into every tissue of your body to give you that benefit. So,
Does it cover, is insurance covered? Does insurance cover this also?
insurance covers hyperbaric for carbon monoxide poisoning, smoke inhalation, diabetic leg ulcers, vascular damage, where you have compromised vessels. There were 10 or so things that were covered by insurance when I used to do this years ago. I don't know if there's an updated list. I'm relatively certain there wouldn't be because it's not the sort of thing that traditional medicine likes. We had a very high-profile restaurant owner who was diabetic and had bad ulcers, and I treated him in my city office, and he did spectacularly well. His ulcers on his leg healed in a matter of weeks where they weren't healing at all. And, of course, I ate free whenever I want to go to his restaurant, which was fun. But, yeah, I think hyperbaric is a great tool. The question is, if you're not pressurizing, then what are you really getting? You're just getting room oxygen, which I don't know it's going to do that much.
That covers it. Last call, guys.
Last call, one more question. Maybe two. So very, very good questions today.
Yeah, right?
As usual, people are thinking, and I say that not jokingly really, but many years ago when I started radio in maybe 89 or 90, I started on WGBB out of Long Island. People were just not calling and asking in-depth, interesting questions because people weren't really thinking as much about this at that point. And then after a while, I got it to a bigger station, WEVD, and it was a 50,000 watt station. We had crazy calls, and people were asking about all sorts of things. But the questions today are just much more in-depth, much more involved, much more disease and organ degeneration related. And it's much more than, I'm tired, what do I do? So I'm appreciative of that. And, I'd like to think that I've been part of getting people to read and learn and look and not just go with the status quo, enrich your mind, learn about things. I think that's why a lot more people are interested today.
Someone's just asking about Parkinson's and stem cell.
So yeah, Parkinson's with STEM, you can see the video on the website. So your brain, in the middle of your brain, you have the substantia nigra. It's a dark part of the brain. and that's where you make dopamine. And as those cells degenerate, like we all have cell degeneration every moment of our lives as we get older, much more as we're older than those that are younger in their teens and 20s and 30s, you're losing the ability to make the neurotransmitter, dopamine. And research in Italy in a big study where they looked at people who passed away from Parkinson's and they tested their brain, sectioned it, they found the substantia nigra was filled with heavy metals, and that's what they think destroyed that tissue. And there was no glutathione in the brain because the heavy metals destroyed the ability for methionine to become the glutathione. So we know glutathione is beneficial. We do those IVs. We use phosphatidylcholine IVs. But the best mechanism for Parkinson's is to use your own cells, intravenous, and a nasal droplet mechanism where we're dripping the stem cells into your nostrils to hit the back of your nasal cavity to get into your brain. And you'll see evidence of this. Research-wise, you'll see evidence with patients that have done it in the videos on my website. So it's probably the greatest mechanism to take your own cells and get them anywhere you have damage or degeneration to create repair.
I'm not sure which part this is referring to, but someone just asked, what if you had a liver transplant already?
Well, any damage or decline of your tissues, your organs, you'd benefit from. If the liver is so bad it needed to be transplanted, the question would be, what are the other organs doing? So in essence, when I see someone, they may not realize it, but looking at blood work, we're looking at all of your organs and how your liver, your kidney, your pancreas, your gut, your brain, your eyes, every part of your body's working. And this is a discussion I have with all patients because we want to look at all of these things. If there's something we need to fix, then we fix. So a person comes in with A, we don't just look at A, talk about A. We look at the entire picture, vitamins, minerals, hormones, everything.
We got, what's best for varicose/spider veins?
The smaller spider veins are typically easily treated by doing little injections with tiny needles to get them to fill up and to stop their progression. You can use laser, which is really the better mechanism for spider and some of the larger veins, because putting the laser device in and zapping it will seal off the vein. That's much more common now than ever before. They used to inject hypertonic saline solution to try to sclerose the vein. I'm not sure they're doing that much of that. Stripping the veins. But laser is probably the best technique for that.
We're up to, that's all I got so far, but you guys are, you're throwing them in there. I love it.
Cool.
What else we got? We go until you guys are done asking questions. So this is your moment, people.
I've got nothing to do except go home and have lunch and hang with the dogs and lay in the sun. I told you that Delilah, knows when I want to go lay in the sun, and she just races to the chair and jumps into the chair before I can get there. A little crazy dog. That's a little.
Transplant of kidney or pancreas? ? I'm a patient of both. Can I get my original back to up and running again?
Can you get function that's like the original function?
They're asking transplant of kidney or pancreas ? Talking about your previous with the part.
So if you don't have your kidney or pancreas, you can't get them back. You can get your body to repair and make new cells of various tissues. That's what STEM does. So likely a person will get a transplant of their kidney because it failed, and likely the same with the pancreas. But there's got to be other residual effects that have occurred as a result of long-term kidney and pancreatic decline and failure. So we would look for those things as well, and potentially STEM would be good for that. Just like we look at patients that have vascular damage that destroys the kidney or any of the organs, or plaque or atherosclerosis. And we've spoken about some great research that's come out over the past couple of years about stem cell therapy shutting down the inflammatory cascade of atherosclerosis. So we've spoken about articles. I don't know exactly where they are on my desk right now, but we've spoken about that. So although you've had transplants, you still want to make sure that the rest of your body and all your other tissues are working to their best capacity.
Any thoughts on DMSO?
DMSO is something that's been used in the veterinary realm forever to decrease inflammatory cascade. Some people have used it for joints. It's sort of like the same as a steroid in its ability to shut down inflammation, but it's got a funny smell and a funny taste as a result of using it on your skin. You got to be careful. Your skin has to be super clean before you put it anywhere because it draws things into your skin. It's a transient benefit, but I'd rather understand why the problem is there and try to fix that organically as opposed to use something transiently, whether it's a pain pill or an anti-inflammatory. Fix the problem so you wouldn't need to use the treatment.
All right. Any thoughts on methylene blue?
I think methylene blue is great. A lot of literature on it, improving cellular function, improving mitochondria, neurologic concerns. And people can look it up on Google Scholar. That's what I tell everybody to do. I have articles, just like you see them messy all over my desk here, on the cabinets in my exam rooms so people can see the articles on methylene blue, rapamycin, how heavy metals correlate with organ failure and cancer and Epstein-Barr with Parkinson's, MS, stroke, cancers, etc. So I put articles up all the time. But yeah, look at methylene blue on Google Scholar. You'll see the benefit. It's typically used 25 milligrams daily, and people see some really good results with it. When you combine that with NAD, or you're looking at comparing and even adding nutrients or methyl B12, you can get some really good brain function with the combination. It used to be used as a dye, and then they found out it had antibacterial, antiviral effect, so it's inexpensive, and I think it's great.
So referring back to the transplant complication, they're kind of explaining it. They said, they are still inside me, never taken out or replaced. Hope I'm where to get right.
So if they're still inside and they're attached, but they had low function and they put other ones in, since they're attached to your blood flow, stem cells will go to those areas where blood flow delivers them. So they'll go to your pancreas, your own existing initial pancreas, and as long as the blood flow's there, it'll get there. How much change will occur over time, I don't know. It's hard to say. But that's a curious question. Most of our type 2 diabetics are non-diabetic in 2 to 4 months. We've even had type 1 diabetics that have had their requirement for insulin drop all the way down. And some people have just been put on oral meds as opposed to having to be on the insulin because it's still there. Pancreas is still there. Now it's just getting new cells.
I'm loving the questions, guys.
Yeah,
Rumble,
these are
shout out.
Super awesome questions. A lot of in-depth questions out there. I'm glad I have my 2 brain cells working so I can answer them.
You're getting a lot of thank you doctors in the chat.
I had 3 yesterday. Now it's down to 2. People say, I don't understand how you can answer questions without taking a pause to think. So I say to a person, well, what job have you done? Oh, I'm an auto mechanic and I repair cars. I said, you could probably take that engine apart and put it back together in a relatively normal amount of time because you know everything about every component of that engine. They say, yeah. I said, well, for 39 years I've been doing this, answering these questions and learning and digging and researching and, spending every bit of time learning and fixing things. So I have yet, certainly over 35 years of doing the radio and, now doing the podcast, I have yet to come across something that I didn't understand or maybe I didn't see within practice. Of course, I don't really see cancer patients. Some of them come in for vitamin IVs to improve their picture. But the majority of what people ask, I've already seen and evaluated and looked at causes and understand why it's happening and have put together recommendations and protocols for it. My mind works that way where it likes to suck up lots of information. Don't ask me what I had for lunch the other day, but,
Do you think MS could possibly be from vaccine injury?
So I think lots of things can come from vaccine injury, especially the latest one that was never studied that has a whole new messenger RNA mechanism that is already shown to create turbo cancers, damage, autoimmune, clots, myocarditis. I think anything's possible. There also are people that have neurologic and MS and possibly ALS-like symptoms that have Lyme disease that wasn't treated correctly. One of my favorite doctors we had on here a couple of weeks ago, Dr. Burscano. He was probably the greatest Lyme doctor for evaluating and treating patients. I used to call him all the time on my Lyme patients, and he always helped me out. He came to my house when I had a fundraiser for George Pataki, the governor, and was able to help support us in our quest for understanding and working with Lyme patients. But and he's agreed to more interviews. So he's just a great guy and a great, great doctor. Great researcher, because that's what he's doing now. But yeah, I think a lot of neurological disorders actually could be Lyme disease that were not diagnosed correctly. And just to skinny on that, the initial bug that we found in the 70s, 80s that was causing Lyme, the blood test was made to that bug. There are different strains that we know now, many other strains that will not show up positive on that blood test. So you could have another strain, you look negative or borderline, and you don't have the original strain, so the blood test doesn't pop. A lot of doctors just do a regular Lyme test, which is the original strain test for the big labs, and they don't test cofactors, Babesia, ehrlichiosis, Bartonella-like organisms. The list goes on, Rocky Mountain spotted fever. So the best lab to use for testing is we use, and I've followed Dr. Burscano's protocols for years, have all of his documents as to how to test, how to treat. We sent out to IGeneX. It's a lab out in California. And they do the best type of immunoblot tests for the different Lyme strains and the cofactors.
Someone's just asking, will this help if you had back surgery already?
For people that have bad backs, we do stem. We also inject it to ligaments. Getting your back to heal is a lot of what is cut through ligaments, tendons, connective tissue. So we've done that, yeah.
And then how can we detox toddlers of heavy metals?
So there are some great pediatricians that work within a, what's the name of the organization that gives lectures? Defeat Autism Now, Dan, D-A-N. And there are doctors that have protocols with nutrients and some chelating agents. Some of them use glutathione topically in a gel on the skin. Some of them use some of the chelating agents on the skin. DAN, Defeat Autism Now, I think is that organization. That would be the place to call to see, which doctors are within the area that would be able to help them. I'm really sure that
DAN?
Defeat Autism Now. Yep. There it is. Yeah, so it talks about all the things that they do. That's probably the largest organization for that. You could look up Defeat Autism Now or autismsmd.com. So, yeah.
All right. What state is your office in?
We're in New York in the beautiful town of Garden City.
It's Long Island if you're not around here,
Yep.
these parts.
Garden City, Long Island.
But he's available for telehealth visits, of course.
Yeah, as well. So we're opening that up to people that can't get to the office, even in-state, or people that live far away, so we can evaluate and at least get your blood work done and start to put a good protocol together for nutrients for you. Just hired another nurse practitioner who's going to help us with the telemedicine that we're doing. We're also working with Medicare patients. We're going to be able to set up blood work to come to a person's home and review the blood work and put them on nutrients and potentially send them blood pressure cuffs, glucometers, a watch that looks at all your vitals. We're going to set that all up as well in the process of doing that. So that'll be a great way to monitor people. So if you have a variety of issues or conditions, we'll be able to just track what your blood sugar is doing and track what your blood pressure is doing and your pulse ox and all of these things, so we can intervene if needed. Think about what happens, and I don't really need to tell people this because they've experienced it for the last 10 plus years. You can't get to your doctor. You call, you can't talk to him, you can't speak to the nurse prac, the PA, can't get in for 3 months. It's crazy. But if we set this up, and I'm going to have to hire more nurse pracs and PAs, where we can get it set up, you call in, you sign the forms, we get the evaluation done, get your blood work done, review that, make the recommendations. We can track you. We can call you once a week if you like and do little mini visits. Depending upon what problems you have and your need, we can coordinate with your primary care, your specialists. It's just a great way to track your vitals. And if something's awry, your blood sugar goes too high, we're notified. We call you, hey, let's talk about this or that. If your blood pressure is too high, same thing. So you can be and have that great relationship with a doctor like never before by doing this with the telehealth. So, terrific
Website
idea.
It's right there, people.
Yep. You can either email us at the website and ask about it, or the phone number is 516-794-0404.
Yeah, so for you in the chat in California, LA County, I'm sorry you live there, first of all. Second of all, telehealth.
Yeah, it's easy to do.
All right. Sure.
All my good friends in LA years ago, they go out to dinner and go out to a club or something, and of course they'd have a few drinks. And if they called me at what was 11 o'clock their time, of course it was 3 hours later here. I had to learn to turn my phone off because they wanted to call and yell and laugh. And once or twice, I turned my phone off at night. Okay, so we're great show today. A lot of questions, a lot of calls. As I say, give us a call at the office. We'd love to help you. 516-794-0404. Website, drcalapai.com. Send us an email. We will answer you. And thank you for listening. God bless you all. Have an amazing day. Bye-bye.